Good morning, everybody. Good morning. My name is Charlotte McLean and Sapo. I'm the Senior Advisor for Disability at the World Bank. I said good morning, but it's good afternoon and it's good evening for many people. We have an excellent number of people joining us this morning in Washington, D.C. My role this morning is to introduce a series of webinars by the social inclusion team at the World Bank. And the focus of today's series is going to be on disability and data. What can we count on? And to help us think through this discussion, we're really fortunate to have Senior Fellow at the University College of London, Daniel Mont. Daniel used to be with the World Bank and is an international expert on disability and data measurement. So we're really excited to have Daniel on with us today. We will also be able to answer some of the questions, but given the time constraints, we'll not be able to answer all of the questions. I just want to say that many people wrote in to ask if this will be recorded. Yes, it will be recorded, and so we will make sure that those of you who are interested in getting a copy later can actually access it. So just by way of introduction, I wanted to say a few words before I hand over to Dan. And I think it's just to emphasize that, you know, when we talk about people with disabilities, we're talking about a substantial size of the world's population. We have 1 billion people with persons with disabilities, and they live primarily in developing countries. And we also know that persons with disabilities are often most excluded, and this exclusion ranges across a whole range of sectors. So they face multiple exclusions: exclusion from education, from employment, from social aspects, and are often discriminated against. And so this is an important point to just frame our discussion this morning. The other important piece is something that's a real life piece, and that is that when we think about developing policy or programs, one of the first questions or one of the first issues that comes before us is, where's the data? Where is the data to begin to make this case, to provide an evidence-based narrative for the inclusion of persons with disabilities and for the provision of services to persons with disabilities? So the issue of data, I think we all would agree, is a really important one. I think in the area of disability, it's safe to say that it's very patchy. Increasingly, we're seeing administrative data, but we still don't have a good sense of the overall data picture for persons with disabilities. And so again, we couldn't have anybody better to help us think this through than Daniel Mont. And so I'm going to hand over to Dan Mont to make his presentation. Over to you, Dan.
Thank you. And it's a pleasure to be part of this webinar series. And it's also a pleasure to see so many people interested in this topic, which I think is extremely important moving forward and trying to make a more inclusive world. So today's talk is about disability data towards improved measures of disability for development indicators. So before we get started, I just want to give an overview of the state of disability data right now. In the past, disability data was of poor quality and varied dramatically, which is why I think many of you are aware that the countries would report very different rates of disability. For example, Laos reported about a 1% rate of disability, and Australia about an 18% rate. And nobody believes that the difference between disability rates in a country like Laos and a country like Australia is really that large. And it goes beyond just measuring prevalence, because if we want to look at the impact of disability on people's lives, if we're not examining the same populations, the same types of people in the different countries, we can't even compare things like differences in employment rates or education rates, because it's like comparing apples to oranges. We need to have a consistent, comparable measure of disability in order to make meaningful investigations of the impact of disability on people's lives. Luckily, in the last 10 years or so, there's been a lot of international efforts to improve the ability to collect comparable, good quality information on disability. It goes back to really a big effort starting with the UN Statistical Division's, UN Statistical Commission's Washington Group on Disability Statistics that I will talk more about. But basically, we now have a set of questions that have been developed and tested in many countries that are being used right now to collect higher quality data. Now, all questions on disability, all quantitative information, there's always caveats, there's always shortcomings, but still what we have now is much better than in the past and is even being developed further. And the final point on this slide is that the population of disabilities of people with disabilities is very diverse. You know, sometimes you talk about people with and without disabilities. That's really not the way the world is. It's much more of a continuum in the degree of disability. There's different types of disability, people living in different environments. And so even though we often say people with disabilities and people without disabilities, when we want to do analysis to look at the impact of disability on people's lives, we really need to take into account that diversity. And I'll give an example of that at the end of this talk. So before we get started, we have to step back and say, what is disability? When we say the word disability, usually in different people's minds, very different things are conjured up in their minds. So before we get started, I just want to ask two simple polling questions, and we'll put the first question up there now. Mary can walk around her single-level home with little difficulty, but is not able to walk a half a kilometer to the market. Do you think she is not disabled, mildly, moderately, or severely disabled? You can vote now. So we can see that there's several things going on here. One is there seems to be a difference of opinion of how disabled she is. And I think this question is actually not a very good question. It's not the kind of question we would want to put on a survey, because disability means different things to different people. The words mildly, moderately, and severely mean different things to different people. And so we get some sense of difference. Now, let me add a wrinkle to this with the next question. Yeah, so if we can have the second polling question up. There we go. What if Mary were 18 years old? What if she were 88 years old? Would that change your answer? So notice what's happening now. There's a lot of people. It seems maybe about a third of the people say that if she were older, she would consider it less disabled. So people are thinking about different things when they're thinking about disability. They're thinking about maybe the expectations of what someone can do, the reasons why somebody can't do something. And we have to think in our minds, why does it matter the reason why a person can't walk when it comes to thinking about how barriers in the environment are impacting the things they can do with their life. And we're going to come back to this theme as we now head into the presentation. So what is the definition of disability? According to the CRPD, it's those who have long-term physical, mental, intellectual, or sensory impairments which in interaction with various barriers may hinder their full and effective participation in society on an equal basis with others. Now, some of the people on this webinar are extremely familiar with this, and some aren't, so I briefly will talk about it. Basically, disability emerges from the interaction between the impairment, the limitations based on the impairments in a person, with the barriers in the environment. So it's more of it's not something which is lodged just in the person. It's something which is a result of that interaction. And this is the concept which is also embodied in the International Classification of Functioning, upon which most of our approach to measuring disability in a quantitative fashion is based. And if we look at the ICF, we see along the horizontally there 3 levels of functioning: body function and structure, activity, and participation. So when we talk about body function and structure, we mean things like being able to move your legs. Right? That's a body function and a structure. An activity is combining body functions and structures to do a particular task, such as walking or seeing. Right? To walk, we need to move our legs. We need balance from our ears. We need to be able. Seeing helps how much our ability to walk, and so on and so forth. Cardiovascular issues. Lots of different body functions affect the ability to do this activity of walking. And participation then is when we combine a whole bunch of activities to take on social roles, like going to school, having a job, getting married, and having a family. And the relationship between these things, between how we function at these 3 different levels, is affected by the environment, environmental factors and personal factors. Somebody with a certain activity limitation in walking might have a very different impact if they live in a remote rural area on the side of a mountain compared to if they live in a downtown modern city with accessible public transportation. There's something else I would call this diagram, and that's a statistician's nightmare. Because when you ask questions on a survey, in order to get good quality, consistent data, you need to have questions which are very specific, that are interpreted the same way by all the respondents, and capture a concept that can be used in a consistent fashion. And when you have a model like this with all these arrows and boxes interacting with each other, you cannot capture this with one question. You cannot capture it with 2 questions. You need a series of questions. And you need to be able to focus on which part of the model which part of the model gives you the information you need for the purpose you're collecting the data. We can't really write a disability question on a survey unless we know the purpose, why we're collecting the data. So previously, these are some previous questions that have been used which are not very useful. Many surveys, many censuses in the past have asked, do you have a disability? This gives us a very low rate of disability, and it misses many, many people. One reason is the stigma associated with the word of disability. People don't want to admit they have a disability, so they will respond no to that. Second, people only tend to answer yes to this question if they have a severe condition, because the word disability in their minds conjures up something, extremely severe, extremely limiting. So people with more mild and moderate limitations do not get recorded by this question. And it can miss the elderly. No matter how significant a disability is, many people, if the cause is because they're old, will say no. I can't hear, I can't walk, but I'm old. Don't have a disability. The second type of question which doesn't work well is, do you have a certain medical condition like paralysis or autism or what have you? One reason this doesn't work, it's impossible to have a complete list of conditions. So you're going to miss some people with certain conditions. A second reason is only people with education and access to doctors are going to know their diagnosis. So you're going to have biased data as well, because people without that education or access to doctors won't know what their diagnosis is. Third, there's a great variance among people with the same diagnosis. 2 people with cerebral palsy might have extremely different levels of impairment or extremely different levels of difficulty doing various activities. And most important, it's completely divorced from the environment. It's saying disability is a medical condition. It gets away from this notion of the social model of disability, where disability emerges from the interaction between a person's impairments and the barriers in the environment. So these are the data that have been used in the past. If your country has surveys and these are the questions they're using, then they don't have good data on disability. So the approach that we want to be taking now is we sometimes refer to as the functional approach. We want to ask questions that get at the difficulty people have doing various activities. Okay, that's where we're interested. We want to focus on if I go back to this here, we want to focus on the trying to move my little pointer, but it's not working, so I'll forget it. We want to focus on the activity section. These are the people at risk of social exclusion, right? If you have difficulties doing certain activities like walking, seeing, hearing, certain cognition, then if there are barriers in the environment, they're going to prevent you from participating. So these are the people with activity limitations who are at risk of being disabled in a social model sense. So these are the people we want to chart to be able to see, if the people who have these activity limitations, if they have worse outcomes, if they're not as employed, if they don't have children, et cetera, that means that's evidence that there are barriers in the environment that are making them disabled. So we're concerned with what people can do, not what people have. Of course, for some public health reasons, we do want to know diagnoses. If you're launching a program to try to prevent polio, you want to know the diagnosis. So it's not like we never want to know diagnoses. But when we're interested in identifying people with disabilities, and when we're interested in trying to see the impact of barriers on people's lives, then diagnoses is not what we want to do. So here are some examples of countries who use different types of questions and the kind of data they get. So in the first column, do you have a disability? We see very low rates of disability. That's because as I said, many people are not picked up with that question. In countries that have used list of conditions, we see a slightly higher rate, but still we're probably missing a lot of people. But in countries that have used a functional approach that ask about the difficulties doing various activities, we see a lot more people identified as having a disability. So the big question is, where do we draw the line? As I said before, disability is not really a binary variable. It's not as if there are people with disabilities over here and people without disabilities over here, and there are these two very distinct groups. What we have here on this slide is a graph of something called activity limitation score. I just don't seem to be able to get my little pointer working. So activity limitation score, without going into a lot of detail, comes from about 40 or 50 questions about how much difficulty people have doing different types of activities. And then we combine them all together into a number. I won't go into the detail. But if our activity limitation score is 0, then I have no difficulty doing any activities of living. However, if I can't do anything, then I'm all the way over here, right? So I'm totally unable to do any activities. And if we look in the population, we find that this is basically how functioning tends to be distributed in the population. There's a lot of people who have no difficulty or little difficulty doing some things. And then there are fewer and fewer people who then have a lot of difficulty until they're really incapable of doing anything. So the question is, where do I draw the line? Do these people not have disabilities? These people have disabilities, but where's the line? Well, the line comes, where we draw the line depends on the purpose for why we're collecting the data. One way we can think of it is, well, where do participation restrictions kick in? So in this diagram, and this is of course oversimplified, but in this diagram, in this particular country or area, when people reach about this activity limitation score, we start seeing them not getting jobs, not getting education, not participating in civic activities. So in this society, disability in the social model sense kicks in around here. In a less inclusive country where there are bigger barriers to participation, it might kick in over here, right? People with less of an activity limitation score might still might have barriers. So where do we want to draw the line? So there have been recent efforts to improve disability data. The Washington group I should explain what the Washington Group is. It's not a U.S. thing. The UN Statistical Commission sets up these things called groups, city groups, and the members can be any representative from a national statistical office of a UN member country. It's always named after the first city they meet in, which was Washington, so it's called the Washington Group. But it's really a collection of national statistical offices from around the world who are working together on a particular data issue. In this case, it was called the Washington Group on disability statistics. So the first mandate, or the first of the Washington Group, was to come up with a question of questions on disability to measure disability prevalence and to be able to disaggregate indicators by disability status. So the definition that the Washington Group came up with was the one I was talking about before: people with basic activity limitations that put them at risk of not participating because of environmental barriers. And that was the short set of disability questions. It's 6 questions, and we'll talk about them in a minute. The Washington Group also then created an extended set of questions, because 6 questions is somewhat limited. So the extended set has more questions that get into these issues a little deeper, and we'll talk about those. What the Washington Group questions aren't as good at is childhood disability. And the Washington Group has since worked with the UNICEF to develop questions on child disability, which are in the final stages of being tested. And we'll talk about that also a little more. And also are now testing a school environment module to try to measure the inclusivity of schools. And finally, the Washington Group is also working with the International Labor Organization to develop a survey for labor force surveys to get at employment issues. And that is, the first draft of that has been made, and it's going to be, testing is beginning this fall. Okay. So the Washington Group short set asks about difficulties in 6 core basic activities: seeing, hearing, walking, communicating, cognition, and self-care. And as I said, it was initially designed for sentences. What's also very important is that there are scaled responses. Okay, so when we ask about disability, if we only ask yes or no questions, we also don't get very good data, because people have a hard time distinguishing between yes and no. You know, if they have a more mild or moderate limitations, they don't know where to put themselves, and so we get messier, dirtier data. Also, we get less useful data because we only have yes and no. We don't know if the person, has more mild difficulties or has much more significant difficulties. And that difference could have a very big difference in the impact on their lives. So it's, as I said, there's this long continuum of functioning. And if we force it to be a yes or no in our analysis, we lose a lot of information, and we lose a lot of nuance about how disability affects people's lives. So these are the Washington Group questions. Now I could probably talk about half an hour on each of these questions. So we'll just say that you can see they say, do you have difficulty seeing, even if wearing glasses, etc. It doesn't say the word disability. Never says the word disability, because that word doesn't work on surveys in trying to identify people. It talks about difficulties in these basic activities. These are actually the result of a great deal of testing. Originally, the questions were more complicated. They didn't work. They had to be simplified. When you look at, for example, do you have difficulty remembering or concentrating, people sometimes say, what about learning? What about making decisions? There's more aspects to cognition. Well, for various reasons, those terms didn't work as well, especially for international comparability. I can talk more about that if people have questions about it. But these questions have been tested a lot and tend to work pretty well. There's always issues. The advantages is it takes a functional approach. It's tested successfully in many countries. It also is, it's very clear, well, it's much clearer than other types of questions in terms of understanding the issues that people have. They have difficulty seeing. They have a lot, or they're unable to see. It's sort of clear in people's minds what it's capturing. And they've been widely adopted. The UN Statistical Division has recommended it for use in censuses. The UN Disability Data Experts Group has recommended it for disaggregating the Sustainable Development Goal indicators. DFID and DFAT Australia have adopted them as the measures for evaluating how well their programs are reaching people with disabilities. And they're being used in a growing number of censuses and surveys. They're also designed to be internationally comparable. If I ask a question like, because of a health condition, are you limited in the amount or type of work you could do? A question like that is definitely not internationally comparable because the environments are so different in different places. But do you have difficulty walking is much more comparable. And it tends to identify most people with disabilities, not all people with disabilities. We do miss some certain groups. I'll talk about that in a second. But when we test it, we feel we are capturing the vast majority of people with disabilities. And they can easily be added to existing censuses or surveys, and even to project data. They take about 1.25 minutes, about 75 seconds to implement. And that's a big deal because sometimes to get questions on a census or a survey, space is limited, time is money, and being able to have a short set of questions that does not impose any kind of burden on the survey logistics is important. There are shortcomings to the Washington Group questions. First, it's not appropriate for children under age 5. You can't use them. And then it misses some children with developmental issues. It doesn't capture the kinds of issues that children with developmental disabilities have. It also misses a lot of those with psychosocial issues that do not affect communication or self-care. Some people with very significant psychosocial issues, it will affect their ability to communicate or take care of themselves, and they'll pick them up. But there are a lot of people with those issues don't have those problems, and they are missed. Also, it doesn't capture the age of onset disability, which is very important when you're looking at the impact of disability. If I want to compare the education levels of people with and without disabilities, if I don't have age of onset, I'm going to underestimate the impact of disability, because if somebody became disabled when they were 30 years old, it obviously had no impact on their education. But if I put them in the group of people with disabilities, when comparing education levels, I'm going to make a mistake. And then they don't capture environmental barriers, right? These questions are focused very specifically on the limitations that people have. There's some environmental in there because these aren't body function structures, they're activities, and activities are affected by the environment, but still they're very basic activities. So it doesn't capture much about the environment or the barriers. But what it can do is tell us the outcomes of people with and without these limitations, which would be evidence of there being barriers. And getting at the environmental barriers would require a special data collection that focused on that. So the Washington Group has taken actions to fill these gaps. The extended set that I mentioned before does include a couple questions on psychosocial issues. It asks questions about anxiety, depression, fatigue. It also has some questions on use of assistive devices, because this is very important when looking at the ability of people with disabilities to participate. Whether they have assistive devices or not really affects their ability to do various things out in the world. And the extended set has also been widely tested and is starting to be used as well. So these questions are not suitable for a census because there's way too many of them, but as a small module in a survey would give us would be able to identify more people with disabilities and more aspects of the kinds of issues that they have. They do not address the environment, though. That will require a different set of questions. UNICEF and the Washington Group have developed child questions. They're appropriate for children ages 2 to 17. And they get at a much fuller range of childhood disability. They ask about things like ability to play and behavior and various things which would not be picked up by the Washington Group adult questions. And then UNICEF and the Washington Group are working on this environmental module that's being tested, and it's asking questions about the inclusivity and accessibility of the school. It also asks questions about attitudes of parents of children with and without disabilities about the place for children with disabilities in the school system. And ILO and the Washington Group have come up with some basic questions about employment and barriers to employment that are also starting to be tested this fall. And the hope is to then develop a more extended set that would be maybe of use in a more detailed disability survey. The biggest issue, I think, the hardest issue anyway, maybe not the biggest issue, but the hardest issue is mental health. Writing good quality questions that get us good, understandable data about people who have psychosocial issues related to mental health. I think it's the weak point right now, and the problem with it is when something's not measured, it can be ignored. And so when we're trying to capture information on people with disabilities and we leave this group out, of the measurement, we don't have the evidence base to be able to advocate for and also develop policies to monitor and evaluate policies as well as we should. The Washington Group has a working group on mental health and is in the very early stages of trying to figure out recommendations of what to do in this area. So it's an issue that they are aware of, but right now there are no, other than the couple questions in the Washington Group extended set, there hasn't been a big output in this regard. So now I want to talk a little about the analytical issues. We have what we think are some very good questions that have been tested that are getting us much better data than we had before. Now we have this data. We want to use the data, right? We want to analyze the data to see what life is like for people with disabilities. And here are some issues that we need to keep in mind. The first one I began talking about already, which is age of onset. Without age of onset, it's hard to tell what the impact on disability has been on a person's life because we don't know at what stage of their life it has been impacting them. And then there's heterogeneity, right? By type of disability, right? By people who have limitations or difficulties, seeing versus hearing versus cognition versus mobility, that might have a very different impact on their lives. And also the degree of disability, right? Some people have more greater difficulties than others, and that could have, again, a big impact on their lives. As a matter of fact, the broader definition of disability we use, as we use a definition of disability that gets us from 1 or 2% to 10 or 15% of the population, what we have is it becomes a much more heterogeneous group. And not only that, because we start including lots of people with more mild difficulties, the difference between people with and without disabilities becomes smaller, right? Because we're including people who have fewer difficulties in the category of people with disabilities. So we have to be very aware and very cognizant of where we're drawing the line between disability and not disability, and to use not just one line, but to think of the spectrum of difficulties that people have. We also have to think about what we call capacity versus performance. Sometimes capacity is referred to in the skin and performance in the environment. So for example, someone with mobility issues, what's their capacity to do various activities without any, say, assisted devices versus with assisted devices? Now you might say, which do we want to know? Well, it depends, again, on why we're collecting the data. So we have to think about, when we're collecting the data, do we care about people's functioning with their assisted devices or without their assisted devices? Depending on the reason for collecting the data, you might want one or you might want the other. But you should be aware of this difference when you're trying to collect and analyze data. And also the big analytical issue is the interaction with the environment. which, like I said, if we can, without environmental questions, we can get some idea that that there are barriers because of the different outcomes. But to really get a detailed sense of what those barriers are and how they affect people's lives, we need to have we need to develop better questions in that area. So here's an example of some of the issues that come up in the complexity of trying to think about disability and development, and the examples with disability and poverty. Quite often, you see this all the time, somebody saying, people with disability are poor. Poverty and disability are related. People with disability are among the poorest people in the world. Now, there is a very big connection between disability and poverty, but it's not that simple. And if one approaches it in this sort of simplified way of thinking about it, we really miss a lot of what's going on, and you can get results which may not make sense to you. So, for example, here are some things you have to think about. The relationship between disability and poverty is impacted by the age of onset, right? If someone becomes disabled to the age of 70, by that point in their life, they might have accumulated a lot of wealth, a lot of experience. They might have raised children who have done well and who can support them, who they can live with, right? So if we don't take into account the age of onset, we can underestimate the impact of disability on young and working age people, So we need to take that into account. Second, environmental barriers and policies can differ by type of disability. So it could be that some people with certain types of difficulties face very big barriers, which lead them to not be able to get jobs or get good jobs and make them poor. But other people with different types of difficulties, who are also, people with disabilities, they may not face such as big barriers, and so it may not have as big an impact on their life. So it's very important that we look at the type of difficulties in order to get a sense of the type of barriers that might underlie differences in people's outcomes. Another thing we have to think about are the extra costs of living with a disability. When people look at disability and poverty, they often use the sort of poverty line, basic consumption poverty line. It's a standard thing to use when looking at poverty. But people with disabilities have extra costs of living, right? They might have extra medical costs. They might have costs from assisted devices. They might have to make modifications to their home. They might have higher transportation costs. So a certain level of income for people with disabilities and without disabilities might be a very different standard of living. As a matter of fact, there's been a lot more work on this recently. One example in the UK, some data shows that the cost of living with a disability is about 1/3 the average income of a person in that country. That means that the poverty line really should be 1/3 higher for people with disabilities, because it takes that much more money to have the same standard of living as somebody at the poverty line who does not have a disability. So if we don't take into account those extra costs, we're going to underestimate the impact of disability on poverty. The next point, poor people with disabilities may have higher mortality rates, right? So if I have poor people with disabilities and rich people with disabilities, if the poor people with disabilities are dying because they don't have access to health care, they're poor, they're going to disappear from the data because they died. So that's something which actually lessens the relationship between disability and poverty, even though at the same time it shows that poverty and disability are interacting in a very serious way. So we need to take that into account. Also, as countries get richer, people live longer, and age is correlated with disability. So if I'm in a country and my average life expectancy is 60, and now I've improved, the country's gotten richer, it's gotten better nutrition, better healthcare, and now the life expectancy is not 60, it's 70, well, the disability rate could go up because a lot of people start becoming disabled for age-related reasons once they pass the age of 60. So a richer country can start having more disability because they have older and older people who are more at risk of having a disability. Okay? So actually when you look at the relationship between disability and poverty in many countries, we find there is no correlation between disability and poverty because some of these other things are not being taken into account. But when we look at disability with a multidimensional measure, when we think about poverty as exclusion, not just as less consumption, but as less education, as less employment, as poorer health, as lower life expectancy, things like that, then we start seeing a much stronger correlation between disability and poverty. So I urge you when using these questions and saying, okay, now I have data that shows people with and without disabilities, as important as it is to sort of disaggregate indicators so we can compare people with and without disabilities on a general tendency, we really need to dig much deeper into the data, take into account the complexity and the heterogeneity of the population of people with disabilities to get a good understanding. And in order to do that, we need good quality data on people with disabilities, and we need that data to be included in the household surveys, the project-related data, the censuses that we're collecting in order to link that data up with the indicators of interest. So what are the take-home messages? Well-tested questions for disability exist, and they're growing around the world, and even more detailed ones are on the way. Care should be taken to use high-quality disability questions. The first thing I think about whenever I see any study or any report on disability is, what were the questions used to identify the population? And if I don't know the questions used to identify the population, I can't evaluate how useful or even misleading that those reports could be. And finally, disability is complex. Population of people with disabilities is very heterogeneous, and so your analysis needs to take that into account. So that's a lot of information. I'm happy to answer whatever questions, and thank you. Oh, wait, and I have one more polling question before I say thank you. We can put the last polling question up. And I'm just curious for you, are there, so people can see, are there any disability questions in any household surveys in your country? Well, I would say, let's see. It seems like for the most part there are, although people don't know. And I would say when you go to find out, don't just find out if they have questions. Find out the nature of the questions they're asking, and whether they're really up to international standards. Some countries say they're using the Washington Group questions, but they change them, they mess them up, and that's not good. But I need to stop now so I can answer people's questions. So thank you very much, and I hope this was useful. So I think Charlotte now is going to choose the questions that you've been writing in on which she would like me to respond. I see this.
Charlotte, can you?
Now for a while I wasn't hearing anything. Now I can.
Okay, so I said thank you very much for a very, very interesting presentation. And we have a number of people online, and so I've culled a couple of questions, and perhaps I'll ask you two and then let you respond and then come back to the next set. So the first question is from Lisa Martinez, and she says, persons who are HIV positive do not experience functional limitations, but are severely stigmatized. Should they be included? That's the first one. And then the second question comes from Benjamin Bernardino. And Benjamin asks, So the Washington Group measures degrees of impairment without considering barriers. Disabilities cannot be measured. So if you could address those two questions, Dan, and then maybe come back for another two.
Sure. Yeah, the people with HIV/AIDS, if they don't have any difficulties doing those sort of those 6 activities in the Washington Group, they're not going to be picked up by those questions. We can't pick up everybody in those questions. I think if you're doing a broader national disability survey and people are facing the barrier of attitudes that are affecting their participation, I think that yes, in a broader measure, they would be included. Like I said, it depends again on the purpose of the questions and which population you want to identify and how much space you have on a survey. To be perfectly honest, if you're only given 6 questions, or 10 questions, you're not going to be able to identify those people. In a national disability survey, where you could ask a broader set of questions, then you could identify those people, and then you can identify those people. Let me go back to the Washington Group questions. Yes, the 6 questions ask about basic activity limitations, impairments. Not impairments, basic activity limitations. They don't ask about impairments. Look at walking. Walking is an activity, right? I might not be able to walk because of a variety of impairments, okay? So it's not at the body function level. It's definitely at the activity level. And what it's identifying is the people who are at risk of not being able to participate because of barriers in the environment. Okay? So if there are barriers in the environment, then people identified by the Washington Group questions are going to have different levels of outcome than the people not identified by those questions. Okay? So by seeing, say, for example, an employment gap between people identified by the Washington Group questions and without the Washington Group questions, that's evidence that there are barriers in the environment that are preventing those people from participating at the same rate. So it definitely comes from the biopsychosocial model of disability. But we can't include in a single question the entire social model. You can't ask a question that's going to work that tries to incorporate everything that was going on in that ICF diagram that I was talking about before. It can't be done. A question on a survey has to be very specific. So you have to, in the analysis, use the data to capture the complexity of the social model, but each element of data that's used in the analysis has to be a very defined concept. And so the Washington Group chose basic activities, like I said, because if you have difficulty walking, you are at risk of not being able to participate in an environment that isn't inclusive.
Okay, Dan, so we have a whole bunch of other questions, and I'm going to kind of cluster them because a lot of people are asking similar questions. The one question is, do you think that the Washington Group questions and other instruments are good enough to support the inclusion of disability-specific indicators and data disaggregation by disability in the new monitoring of the Sustainable Development Goals? That's the first one. And then the second one the second cluster is really, why do we need to collect data?
Okay. So I absolutely think that the Washington questions are be very useful for disaggregating the SDG indicators. As a matter of fact, the UN Disability Data Experts Group that was convened by DESA has made the recommendation that they be used for that purpose. And the Washington Group even has a white paper out on it explaining more about this. We need to collect data for a few reasons. The first reason is to be able to motivate action, right? To be able to document that people with disabilities are facing barriers to an extent that's really impacting their lives, that it really is imposing costs that exclusion is imposing costs on them and on the rest of society. So it's that motivation, sort of further justification for action. The second is to develop policies, right? maybe we find out that people with disabilities aren't working as much as people without disabilities. Well, why is that? Where are the barriers? What types of people are having the biggest problems? Where are they located? So we need information about their lives in order to be able to develop effective policies. To be able to see which policies might affect the most people, where the biggest needs are, right? In order to really understand that, you need to have population-based data, not just anecdotal data from people, say, who are involved in organizations. And third, we want to be able to monitor and evaluate those policies. Let's say we have a new program for rehabilitation, or we have a new anti-discrimination law, and we want to see, well, has this impacted, people's lives? How much? What are the benefits in terms of money? What are the benefits in terms of people's well-being? Without data, we can't say, aha, this program worked, is effective, so you should continue it and expand it. This program didn't work so well, it didn't really have much of an effect. We have limited resources, we have limited time. We want to be able to put our resources and our time into those activities which are going to give us the biggest return. So we want to be able to justify and advocate for policies. We want to be able to develop ones that are well suited for the situation, and we want to be able to evaluate them so we can identify best practices that can be scaled up.
Washington Group. The one is, does the Washington Group have a plan to develop recommendations for supplemental research to fill in the information on the barriers and attitudes that may be missing? And the other one related to the Washington Group was, does the Washington Group provide training to governments and statistical commissions around developing and ensuring that the disability questions are used at national level?
I'll answer the second one because I missed the first one, but if you can go back to that one. Yes, the Washington Group does provide training. In the past, well, first of all, any national statistical office that in the world can come to the Washington Group and participate in it, and over 100 have to some extent, although there's really only maybe 20 or 30 that have participated a lot. There have been some trainings, but that has been an issue because the Washington Group doesn't really have a budget and it's really volunteer. But the Australian government has just given a grant to the Washington Group to enable us to ramp up our training activities, and it's starting this fall. And so we intend to have regional meetings, a meeting in every region for training on disability data, as well as hopefully enough money to even do one-on-one training in different countries. So yes, if your national statistical office contacts the Washington Group, there are definitely even more in the coming years opportunities for capacity building. Oh, and I remember the first question was on research. The Washington Group really focuses on developing the data, not on doing the research. Although they realize that we need environmental questions, and so we've begun work on those. Education was the first area where we developed environmental questions. Now we're starting to work on employment ones, and the hope is that over time, civic engagement is an area we haven't looked at yet, which is where there's a working group is going to be established on that. So we're trying to build that up. We started with the prevalence and disaggregation, then we moved into children and more detail, and now we're starting to move into environment. It takes a long time to develop and test these questions.
We have another question here about people are curious to know, Dan, how DFID and DFAT are using the Washington Group questions to monitor disability inclusion in their program. Could you speak to that a bit, please?
Yes, the main way is that they say that all outcome indicators, I believe this is true. I'll put this at like 90% sure of this, that all project outcome indicators would need to be disaggregated by people with disabilities to make sure that their projects are reaching people with disabilities to the same extent that they're reaching people without disabilities. So I think that is, I think that is the hope, and hopefully they'll go beyond that. Like I said, because a simple disaggregation, while important and useful, doesn't, like I said, doesn't really get at the complexity. You really need to have a real sort of disability situational analysis to really understand what's going on. But collecting that data and doing that first step disaggregation, I think is a very big step. And I'm really happy to see that DFID and DFAT are doing that, and I hope that other bilaterals will follow suit, and international agencies.
We have time for one last question, and again, I've kind of pulled it together as a number of people have been talking about intersectionality. And so if you might then just say a few words about the intersectionality. Persons with disabilities have various identities. So you could be a woman, you could be LGBT, and how do these intersectionalities, how do we capture this in data, or do we?
Yeah, I mean, I totally agree. I mean, that there's interactive effects. I mean, disability can affect, say, for example, boys and girls differently, both in the ways and in the degree, for example. But if you collect data on gender or LGBT, or if we collect data on other characteristics, aspects of people's lives, and we collect data on disability, we can, in the analysis, we can explore that. We can't ask a question about those interactions because we have to ask so many questions, and they wouldn't work. They're too complicated, and the data that would be collected from a complicated question about how does, as a woman, how does disability affect blah, 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 that kind of a question does not work on a survey. It can work on a qualitative focus group type thing, but on a quantitative survey, that kind of question doesn't work. But if we collect data on gender, and we collect data on disability, and we collect data on ethnicity, and we collect data on all these things on the same survey, then in our analysis, we can explore that interaction.
So apparently I have time for one last question, and the last question will be, what questions stroke measurements were used to showcase the 1 billion people with disabilities? And that comes from Diego.
Okay, so that was from the World Health Surveys. There were these World Health Surveys that WHO did in, I forget how many, dozens of countries. And they asked questions about activity limitations. And so they have like that, sort of like that activity limitation score slide I put up before. And then they had to draw the line somewhere. And in order to draw the line, what they said was, oh, let's look at the people who have conditions, medical conditions, who are clearly we would say clearly have a disability. Let's look at their activity limitation score, the difficulties they have doing different things. Now, let's forget about the diagnoses and look at all the people in the population who have that same level of difficulty doing various activities. And we'll say those are the people who have a disability. So it's not identifying people based on their medical condition. You don't have to have a medical condition to have a disability according to that data, but you have to have an activity limitation score that's comparable to people who have medical conditions who we think are clearly have a disability. So that's the methodology that they use.
Dan, we have loads and loads of more questions, but obviously we can't answer them all today. I want to thank you, Dan, particularly for spending the time with us and walking us through this very, very interesting presentation, and then thanking all of you who participated this morning, this afternoon, this evening, wherever you are. We've had a really, really rich discussion. We've got excellent questions. We will continue to engage. I'd like to thank our sign language interpreter, but I would also like to invite you all to remain aware of the webinar series on social inclusion and tune into those as they are announced. And I'd like, in closing, to ask everybody to fill out the survey. There is a feedback survey. Please make sure you fill them out because we would like to improve our webinars going forward. So thank you all very much for a very engaged session. Bye-bye.